Okay, let's roll. My name is Yvonne, and I'm so excited to be with you for this occasion. I want to just tell you ahead of time that I'm going to pause and I'm going to ask some things of you, just your thoughts on a couple of issues. So, because I want this to be interactive, I don't want to talk at you. I want to talk with you. But this is truly a privilege, and I'm so grateful that you're taking this course. Because to me, you are what matters, and we're going to focus on that. The agenda that I have set is over the next 40 minutes, I want to cover why this topic is important. We'll look at waste in healthcare and why this is such an issue. But then we're going to focus on the optimism, the excitement of what is happening, both on the international, national, and local levels. And then at that point, too, I want to come back to you and have some reflection of what your ideas are, because you're the next generation. And I'm going to throw out some things that are being published and happening now, but this is a movement, a work that's really in its infancy. A decade ago, there was been little to none out there, because I think more and more with what we're seeing in climate, it's getting more attention and becoming more emergent. So with that, my objectives are that we'll describe the sustainability progress, again, on different levels, internationally, national, and then local. I want you to be able to explain several strategies to reduce healthcare waste and carbon emissions in different healthcare settings. And then I want you to leave here with the optimism and the opportunities that we can make a difference for generations to come. Before I dive in, though, I want to get to know my audience. And so if we could just pause for a second, I'd really like to hear what area of medicine you'll be practicing in, and what inspired you to join this class. In other words, why is sustainability important to you? I mentioned to you that my area of practice is in critical care medicine. I've worked in the medical ICU for 20 years and have really seen change to become more and more, will create more and more waste over time. The reason why I'm here is it's a deeply embedded value that started because I was one of 6 children in a big Catholic family, and was not an affluent family. And when I grew up in the state of Oregon, and when there was an aluminum can or a bottle on the side of the road, my mom slammed on the gas and had one of us get out and get that can or that bottle. Because in Oregon at that time, it was 5 cents per can or 10 cents per bottle, which I looked up now is about 50 cents for an aluminum can. You know, but back in the day, it was 5 cents, but that value now for a family. So I now still instinctively have that urge to grab the aluminum can out of the trash or out of the bushes, because it's so deeply ingrained. So if we could just come back to you now, and you could tell me, where do you see yourself in medicine, and why are you here, basically? You want to start, Sarah?
Yeah, hi, I'm Sarah. I am going to be going into the field of anesthesiology. What inspired me to join this class was I just wanted to learn more about climate change in general. I mentioned to Dr. Drummond last week that I'm from Yuma, and so there's a lot of agriculture and heat, and so I was kind of curious to learn about those specific things. But I'm also interested to learn more about sustainability. Just, going to be in a field where there's a lot of waste in the OR and, medical waste in general. So I'm kind of excited to learn more about how all of this affects the healthcare system. And it's important to me because it's our future and, the planet that we're going to live on and whatnot. So it's definitely relevant to all of us.
I love that. Thank you. Okay. Is it Kaylin?
Yes, correct. Hello, my name's Kaylin. I'm going into emergency medicine, and I love the outdoors as a lot of emergency medicine people like. And I think that's kind of what inspired me to join the class and why sustainability is important to me. Pretty much any of my free time spent outside and seeing the climbing season get shorter and shorter because it's getting hotter and hotter is a big bummer to me. And I've never had the opportunity to take a class about climate change, but I've clearly seen the effects of it. in the past couple of years. So I would love to learn more about it.
Thank you. Great. April.
Hello, I'm April. I'm your daughter. And I'm in this class because I have climate anxiety. And it's just a value in my family to protect our planet and try to do our part.
And you're going into emergency medicine. Very cute.
I'm Eric, intervention. And April, I have a lot of anxiety, mostly centered around water use growing up in Arizona. So that's what I was really interested in. And I see a lot of waste in the field that I'm going into, unfortunately. A lot of the things that we utilize are like single use and a lot of just plastic and on the production side, a lot of waste of water also. So that's why I was interested in this class.
Awesome. Thank you. Okay. Oh, is it Ilya?
Yeah, that's right. Hello,
Hi.
I'm Ilya. I am taking this class partly because as I mentioned to everyone when I during my introduction last week, if I wasn't doing medicine, I would be doing some kind of environmental work or something in biology or something like that. So I feel like this is a nice thing to do while in medical school. I get to interact with that side of things a little bit. And in terms of specialty, I'm going into neurology.
Nice. Okay. Great. Thank you. All right, David.
Hi, hello. I'm going to internal medicine, and I chose this class because I was just interested in learning more. Recently my parents have been talking a lot about uh, going solar, and they finally did, and now they can't stop talking about it, and now they're talking about getting an electric car, and so it's kind of something that we've talked about and just wanted to learn more about.
Nice. Family value. Very cool. Okay. Thank you all. Now it feels more relevant now. I kind of, because I want to make this talk relevant to where you're headed. And so thank you for that. Okay, so let's talk trash. It's so easy for us to not have to think about or face all the trash we're creating with the daily Starbucks, the DoorDash, et cetera, but it's dumping into other poorer nations and poorer neighborhoods, as you know, and yet we can make a difference as we're accumulating and populations are growing. It is encouraging to see more discussions about how to curb this, and that I want to be on the optimistic side about action in this presentation. And in healthcare, the waste can seem overwhelming. The gloves, the gowns, like Erica said, it just feels like there's so much single-use stuff more than ever. However, let me also add that in a recent study, they were capturing that healthcare generates about 5% of global greenhouse emissions. It should be emissions, forgive me, which doesn't sound like much, but then they describe it as equal to 500 coal-fired power plants, and that sounds like a nightmare of emissions. If healthcare were a country, it is described that it would be the 5th largest polluting country on the planet. So, and this comes out of Lancet Planet Health in 2020. So this is why now it's gaining momentum. They felt it was important to describe its enormity in order to get more attention to this issue. But exciting things are happening, and some of the leaders, I'm first focusing on the intensive care unit because that's my area, but I'm going to broaden it to your areas of future as well. Some of the leaders were out of Australia, New Zealand, and that intensive care society is literally on fire. They were on fire, as you know, in Australia, New Zealand, Australia in particular, but they came together to form this beginner's guide to the sustainability in the ICU. And in there, it's a 34-page document where they pulled together all these ideas that apply not only just to the ICU, but to clinics and other aspects of healthcare. And it's a very impressive first initiative, comprehensive work. But they're pulling in the United Kingdom, and the United Kingdom has this nice recent publication in which they pulled together their literature, and it's kind of this interactive site where you can click on, for example, reduce, and each of those little pictures on the circles leads to a pub that suggests how you can work on reducing or reusing to reduce our carbon footprint in healthcare. So as I looked at things going on in Germany and things going on in Canada, and I thought, well, what's happening with my own Society of Critical Care Medicine? And this is the world's largest organization for critical care medicine. It pulls in emergency medicine practice. It pulls in all aspects of critical care, you know, CT, ICU, neuro, et cetera. And they were doing nothing. And this was just November. I was looking, and they had nothing except a podcast. And it concerned me enough that I actually contacted the individuals who did that podcast about sustainability. The speaker was out of Canada. They're doing some really cool stuff up there. And I said, what do you think? How can we get our own American society to start doing something? And I went to the conference in January, which was in Phoenix, and I approached the president of the organization. I talked to people on council. I said, why are we not doing something in sustainability? And the interest was there. It just hadn't been sparked, perhaps. So I'm happy to say that this letter shows that just a couple of weeks ago, I got an invitation to be on the first sustainable task force for the Society of Critical Care Medicine. That includes 80 nations. And we're going to work with the UK and Australia, New Zealand, and Canada to come up with something even bigger. So just an example of how we can start like asking questions and digging into why isn't something happening, and then make something happen. In terms of the emergency medicine, I'm really inspired by how, despite the intensity of them being on the forefront of life-saving, you know, practice, these individuals are also on fire, perhaps as one of you alluded to, because they love the environment so much. You know, they are a culture of people who tend to be into fitness and stuff. At least that's been my sample. I don't know if there's actually data, but that's been my sample of the individuals who go into that there is some deep caring. And so there's quite a bit of publications coming out of emergency medicine. This is just one of them, and this was in London. And this Royal College of Emergency Medicine publicly divested in fossil fuel funds and encouraged the membership to do so. And then they established a green emergency department and invested in things like turning off lights and computers. I want to show you a nice clip of a little film that they came up with to show their enthusiasm and some of the things they're doing in emergency medicine. So am I just going to stop my share here and try to connect with that? I hope it works. Still trying to find my film here. Yeah, there.
A lot of people underestimate how much people care
Can-
about environmental sustainability.
As an emergency medicine physician, I have treated people in this country who've been affected by the climate crisis. We did have the hottest summer ever last year in 2022, and we know now, looking at the statistics of that, there was about 3,000 excess deaths in those 2 weeks. It is all around us and is affecting our health right now.
We've got a duty to solve the planet's issues now. Unless we start today, we're not going to get there in the future.
The emergency department is always there. We're open 24 hours a day, 7 days a week. Lots of people come through us, and especially now with the emergency care crisis, we've got people in our departments for a very long time. So we are a place where there is quite a lot of burden and where there's a lot of carbon footprint coming from that.
The Green ED program came about after we formed the Environmental Special Interest Group. And we created a new committee a few years ago to look at the environmental footprint of emergency medicine. The answer to us seemed obvious: to get a team of clinicians together, form a committee, see what they thought. And out of their enthusiasm came the Green ED initiative, which was a way of benchmarking good practice, if you like, in environmentalism, and working on areas of reducing the carbon footprint.
This is probably a key milestone over the last 4 years. And we're excited to launch a framework and partner with our members.
We looked for specific actions that you could take as an emergency medicine practitioner to change your practice or to change things, under your control.
The framework itself is about taking one action at a time. It's clinician led.
Our goal with the Green ED is that in 15, 20 years time, if you're a gold standard Green ED, then you will be a net zero ED, and that's what we want to achieve.
At Preston Hospital, we were one of the pilot sites for the Green ED project. So that ran over the course of May to December 2022, where we took the framework that the Green ED project had developed and we tried to embed that into our practice. And we developed a group of about 30 people ranging across the department. So not just doctors, it included our nurses, our consultants, our healthcare assistants, our domestics, our admin staff, all trying to feed into this idea of sustainability and how we could improve our department. We found that to be a really positive experience. We managed to embed some real sustainable change. We got a lot of enthusiasm on the shop floor. And then I wanted to continue to work with the team to see how we can carry on that work and spread it out nationally.
I know that a lot of my colleagues out there are wondering what they can do, and actually I think their hearts and minds are there. They want to do something, but they just don't know what to do in the healthcare system. So I think the key thing that we've been able to do, and over the last year specifically, is show them that you can make small changes in your practice and to become more environmentally sustainable, and you can do that on top of the emergency care crisis that we're experiencing.
At the college, we really try and mirror the sort of can-do attitude of our members, and they display that in their everyday life on the front line, and we try to mimic that very much. So the leadership team are all excited.
I do have a message for our membership, those doctors and other health professionals working in emergency departments. We know how hard pressed you are, but we're taking the environment seriously as part of the many things we do here at the college, and we know it's important to you. So please do get behind the Green Emergency Department Initiative. It's coming your way very soon. You can sign up easily, and it's going to be a great success, we know. So be one of the trailblazers.
Ultimately, we're doing this for the next generation in the hope that they can build on what we achieved through the Green ED project.
Okay, we're back on slides. I thought that was kind
Good
of,
afternoon and welcome
Uh-oh.
to the 2023 Harvard Medical School
Can you-
and Harvard School of Dental Medicine
Yeah, we
Wayne
hear
Cook
that.
ceremony.
so just a second.
I think it's YouTube rattling on.
So wonderful to say hello to all of you out there, whether in person or joining in on the live stream. My name is Bernard.
Sorry about that. I forgot to turn off YouTube when the video was over. Okay. So anyway, there's I thought that was an inspiring video that shows that things are happening. More initiatives that are happening in the emergency department, in the intensive care unit, and elsewhere are listed here, starting with a contracts review. And this was kind of a fun learning point that I learned with Dr. Drummond and Chris Edwards out of our own emergency department. They were looking at getting away from giving medications as an IV piggyback. That's these, right? These administrative, these dosage forms. It often comes with a foil wrap and then this plastic and all the tubing. And could we instead give the patient with a significant infection, give that first antibiotic as an IV push instead? Or potentially, do we need the IV dosage form at all? Could we do it as a tablet? Well, interesting, what Chris found in his investigation was that there is a contract with the producers of this piggyback product that if we use a certain number of them, we get a price break. So they what my understanding was is that if we then, as a whole emergency department, went away from using these, then we would no longer get the price break. And Brian, correct me if I'm wrong, but that's what I understood it to be said. We need to go back to our contracts and see what the price breaks are and get away from them so that we're not forced to be using these products. Another initiative that's being described in the literature and discussed here is using the dry powder inhalers versus the meter dose inhalers with the propellant that we know is toxic to the environment. I went back and talked to my pulmonologist that I work with here in the ICU, because they also do clinic. They also take care of patients with asthma and COPD. And so I said, do you use only dry powder inhalers? Are you getting away from these? And they said, it's complicated. It depends. Insurance sometimes won't cover the dry powdered inhaler. So there's other things we have to do to get around that, or to press the insurance companies to get away from this mandate that the meter dose inhalers are still used, or the cheapest option. In terms of IV versus oral medications, after I started doing this work, I went back to my own intensive care unit and started verifying some of the orders that the doctors had placed for the critically ill. And I noticed that for one of my patients who was not so sick, was actually eating a sandwich, the nurse had ordered potassium replacement for hypokalemia, but she ordered 4 bags of this. And so I ran over and I said, hey, why are we doing 4 bags of 10 to go through the peripheral vein as opposed to the tablet? And she said, huh, I hadn't thought of that. So we changed the order to the tablet, but it made me realize it's not her fault, but it's in the system. We have to have ways in which people go to order a potassium replacement, and it defaults to a dosage form or some inquiry of, is the patient able to take orals? Because that would have created a lot more waste unnecessarily, and another injection into the peripheral vein, or infusion into the peripheral vein, that always increases the risk for infection. So IV versus oral medications is something that pharmacists can do, but also the medical practitioner that's ordering it. Then in terms of reusable gowns and plastic gowns, we certainly started to use some reusable gowns during our shortage during the COVID campaign, and they were really nice. But now I noticed that at a UC Davis, they are taking on an initiative to go to reusable gowns more broadly than the plastic, making the argument that not only does it reduce waste, but there's also less water use in the reusable gowns, because there's actually less water required to launder those gowns than in the manufacturing of the plastic gowns. So I didn't see a cost analysis, but nonetheless, UC Davis is going after that initiative. And then ambulance idling and transportation, other transportation coming to the healthcare institution, when they're idling and burning all the fossil fuels, et cetera, making it an environment where people are breathing in these fumes. Brian has talked about that in our own ED. It's also described in literature, and looking at the opportunity to go to electric vehicles ideally. More ideas. These initiatives are coming out of Canada. Canada is a leader in some of these initiatives in which they have eliminated the use of plastic grocery bags in the nation. And here, in recent years, we have gone from for example, for the delivery of blood transfusions or platelet transfusions, we went from small paper bags with a little, little handle, now to plastic bags, and those plastic bags go right in the trash. And I don't know if you've ever gone down to do a trash cleanup, but those plastic bags readily break down in the Riedo, in waterways. They're hang in the trees, et cetera. These are such a burden, and yet there are blocks, for example, in the state of Arizona, in which we cannot eliminate the plastic bags. They've actually had legislation that blocks the individual towns from eliminating the use of plastic bags. Other states have eliminated them, but in healthcare use, this is something we can press our institution to do as well. Reusable sharp containers instead of incineration. I didn't even realize that those big red bins that hold all our needles and other sharps are incinerated. And what a huge carbon footprint that could be. And if there were reusable options, could it be cost effective? Could we go that route? And then reducing the glove use in healthcare. When I heard that, I thought, we can't reduce gloves in healthcare. Like, this is really important infection prevention practice, right? But in Canada, they are actually going after it. And the more I hear it, the more I see the feasibility of it. I love these huge gloves that guy is wearing in the picture, and I'd like to walk around the ICU wearing those. The thought behind it is that we excessively glove because of the impression that it is more sterile, but it is not. In fact, it can give you false protection. I spoke to the infection prevention leadership here in the ICU, and I asked them about some of the initiatives, and he mentioned that there is excessive glove use. He said when they go in as an administrative team with the chief medical officer and the head of nursing to look at central lines and whether they're inserted and cared for properly, he said, I'm the only one who doesn't glove. Everybody else puts on the gloves, and we go in, he pulls back the gown, they look at the central line, they do their checklist, they leave, and he does good hand washing where the others take off their gloves and put on another pair of gloves to go in the next room. Excellent hand hygiene, good hand washing is superior to using gloves. When I talked about this to my medical director, he too said, I glove way too much. And how many of you have seen glove use in things like the airline stewardess or our own mailman? I saw that she's wearing gloves handling the mail, when what you could really do is, you do the job and then do good hand hygiene. So this is some of the initiative of they're really questioning, why are we gloving? Do we really need to glove if you're not handling or going to be exposed to body fluids? And then the packaging. How many of you have reached for a glove and then had 3 spill on the floor with the packaging? Right? Yeah, it's not well designed. And does Banner administration or those who made that purchase, do they realize that half of this is going on the floor? And wouldn't that be an interesting study to see how many gloves are actually used and how many end up on the floor? And could there be a more cost-effective packaging so that we don't have that waste of things spilling on the floor? In my own ICU, I noticed that there's all these line kits, and you can see that this picture on the side is the doc box where the physicians do their charting. And I don't know how. Here's an example of this line kit. Those are stacking up in the corner of the room. Cut kits for thoras and paras and syringes and needles. And I asked the docs, where is this coming from? And they can't seem to tell me. I don't know if one doc pulls the line kit and the other one does. And they say, oh, I already have one. It gets thrown in the corner. But I took those line kits and I went to return them to storage because it's waste. And the nurses said, oh, no, you can't put that back in storage. And there's a sign on the door right there. That's our storeroom that says you do not return supplies to the supply room once taken into a patient's room. And they don't know whether these line kits accumulating in the doc box have been in a patient room. So they wanted all that stuff thrown away. So again, I approached infection prevention and said, is this true? We have to throw away anything? And they said, actually, it's not. This sign on the door is an overreaction to a Acinetobacter outbreak. And if these things are properly wiped down with these super wipes that kill everything and cause cancer, if we wipe those down, you can return them to storage. So I'm making a plea to the management of my unit. Let's take those signs off the door and reinforce that they can be wiped down and returned to storage. That pile that you see in the corner of that picture, we cleaned up, and a week later it was back again. So I don't know what's happening in the doc box, but all this stuff we are throwing in the trash if I'm not there. And so we've got to change the process. We've got to change the understanding of what we can return to the storeroom. Let's see, did I skip a slide there? I think I did. Sorry. The other thing is that I went up to our chief medical officer, Dr. Gordon Carr, and I said, I want to actually Brian Drummond and other membership want to make a difference here at our institution. We want to reduce medical waste. And I could tell he was not very interested. He said, I'm more interested in reducing central line infections and DVTs so that I could get patients out of the ICU faster. And then you'll be reducing medical waste. And I couldn't help but think, I get that. I get that very much so, because it improves patient outcomes. And by shortening their length of stay, we will reduce waste. And so I said, I will invest in that, even though I am a pharmacist. So getting SCDs and central lines are usually not my thing, but I have added it to my daily checklist now, so that when I round on each of my 24 patients, I go back to reminding them, let's checklist. Is there a line that can be removed? Do we have DVT prophylaxis? Are there SCDs? And the other thing I want to add to that list is unnecessary labs, because often in the ICU, there are labs ordered that are every 4 hours or every 6 hours, for example, in DKA. And yet the situation has resolved, but the orders haven't been discontinued. So we are drawing blood, we are charging the patient, we are using more tubes by unnecessary labs. So that's another thing I'd like to add to the checklist to reduce waste. In terms of refillable water bottles, and all the plastic we create with buying the plastic water bottles, it's interesting that this study came out just last January showing the plastic particles in bottled water. There's actually been studies that show that bottled water is tap water that they have bottled. I mean, sometimes it is not superior, but filtered water is universally supported, and there are filter stations in the hospital, but there's really not enough of them. And my thought is we should encourage or recognize those who are bringing refillable water bottles and using them. I asked why there aren't more of them, and the administration said that they implemented a refillable water station at Duval. How many of you know where Duval is? Yeah, and Duval is way over by the old entrance to the hospital. And so that is, nobody's going to use that. I don't know why it's over in Duval. And I recognize that if we have more refillable stations, it's going to reduce water sales from the cafeteria. I recognize that as a loss of revenue, but yet it's the right thing to do. And I want there to be more convenient options for staff to be able to refill their own water bottle and reduce plastic. Here's another idea that I have, and this is my first nursing newsletter in which I thought that I could start initiating small measures of sustainability, but combining it with medical education. For example, the nurses sometimes feel confused about the difference between norepinephrine, epinephrine, and phenyl, and they've asked for some information about that. So I put that in there and some other things, but then I also put in have the flowers faded? And this is my attempt to have them stop throwing away the vases that are left from the flowers that are sent to the ICU. You see, people want to send flowers to their loved one because they're sick, but often they're sick for so long that the flowers have died, the vase is there, and we're stuck with all these unusable vases. So I've asked them to give them to me, and I take them to a local florist, and they're always thrilled. And so I just put that in the newsletter to kind of combine. I'm not talking about sustainability, I'm not talking about climate change, but I am talking about reducing waste and kind of planting an idea. And then the other idea I planted in this newsletter was that I had gone over to the step down unit right next door to the intensive care unit. I noticed that over the recycle bin was a sign that said they were collecting aluminum for a fundraiser. So I thought, what a great idea, so that those people who don't care about aluminum going in the trash, don't care about climate change, maybe have a different incentive, a caring incentive to not put it in the trash, but to put it in the recycle bin. And we can contribute to the fundraising of our sister unit. There was also one of our nurses recently who's been here a long time and everybody loves, lost her stethoscope and put a sign in the break room, if anyone finds my stethoscope, please give it back to me. And it hasn't been found. So I thought that would be another way of us to say, let's do our own fundraiser. Let's not throw away our aluminum. Everybody put your aluminum in the bin, and we can return it or submit that for replacing her stethoscope. Let's do a fundraiser. I looked to see how much you can get for aluminum, and it's about 500 cans is $10. So it is a lot of cans. It would be a lot of effort. But nonetheless, the message is stop throwing away your aluminum, create a new habit, and then potentially we can turn that money into something, some kindness for someone on the unit who gives a lot. More ideas. Banner does not recycle. They have the bins all over the place, but they don't recycle. And so I sent an email to administration asking, why do we have recycle bins when the beverage containers go in the trash? The response was, they won't serve us. We're too big of an institution. Wait, so I called Waste Management and I asked them, and they said, that's not true. We serve the entire University of Arizona campus. We would be glad to serve Banner. And so I responded again to administration and said, hey, there must be an misunderstanding. They will serve us. Can we start doing this? And I didn't hear from them for a while. And then I followed up, and it took about 2 months, but they said, oh, we met amongst the board or whatever, and it's too expensive. So we have these recycle bins and it's too expensive. Well, in talking to Brian and the organization that we're involved in, he said, let's start a petition. So we are starting a petition to try to put pressure. We want them to say, medical staff wants to recycle. The community wants you to recycle. Patients wants you to recycle. We are going to get lots of signatures to put more pressure on them to reconsider doing this. I also found it very valuable to get to know the cleaning staff, the cleaning lady, the environmental services employees, not only because their service is extremely important as a member of our team, they do a vital service and we want them to feel valued, but also once you establish rapport and have a relationship with them, then you can say, hey, I noticed that you're throwing away the cardboard, but there's one thing that Banner does recycle is cardboard, and there's a big bin for it. Hey, since I've seen you throwing away the cardboard, is it okay if we put that in the recycle bin over here? And then they start thinking about it, and then you become a team in that value. Other ideas that are showing up in the literature are pill paper cups, kind of like the ones you use for ketchup and mustard in the restaurants, because currently we go through a lot of these. So wouldn't it be a good idea to just go with the paper? And if they're too small, then why not create a demand for a little bit bigger paper size, something that will biodegrade instead of accumulate in our landfills? I went down in the cafeteria and I asked for the manager, and I asked how much silverware, disposable silverware, we go through at just this institution in a week. And she kindly followed up with giving me the numbers that you see here on the screen. In 1 week, over 15,000 spoons, 15,000 forks, thousands of knives, and thousands of straws in 1 week from one institution. So could there be an initiative somehow to start bringing either pressuring them to use compostable or biodegradable silverware and straws, paper straws, or could we also be encouraging people to use reusable silverware? In the break room of my ICU, I brought silverware, metal silverware. We have a silverware drawer, and it's got all the utensils in it. I buy it from Walmart. I find it in thrift stores. I've even contributed some of our own silverware into this drawer. And it doesn't last. It walks. I find it sometimes in the trash, or it goes in someone's lunchbox home. I even had a nurse come in and open the drawer and see the reusable silverware, and then she went, oh, and closed it and said, there's no silverware. And I said, oh, please feel free to use the reusable. You can just have to wash it, and then we can use it again. And she said, I don't want to wash a spoon. And then she went off and went to find the patient supplies so that she wouldn't have to wash a spoon. I try not to get too discouraged with those attitudes, because when I come back to the ICU and I see that physicians and other individuals have filled the recycle bin, knowing that we recycle, I think for every one of those, someone cares enough to not throw it in the trash, but to come over here and put it in the recycle bin. And so there's more we can do to reduce all this disposable waste that does not biodegrade. A few more ideas, and then I want to come back to you. Connect with like-minded organizations. Months ago, I was still just doing my silverware and taking home some aluminum, really feeling like most people don't care. And then I saw something on the news, and I Googled for Arizona, is there anything that healthcare professionals are doing? And I found this organization I grabbed my daughter when I found out it was out of my own emergency department, and we went down and met Brian Drummond. And this has been a huge game changer. I was so excited to find out physicians care, because as you've been told so many times, I mean, you have credit, you have status, you have a voice that people really honor. And so to find that physicians actually care about this was such an inspiration to me, that all the efforts that I've described to you in the past slides have been in the past few months since I met Brian and found out physicians care in Arizona. So a huge game changer to find other people that want to do the work, that want to make a difference. We recently partnered with Sustainable Tucson, and I'm finding that there's other little organizations, but we need to pull together, because when it comes to policy or voting or who to vote for, et cetera, we all want to be on the same page in order to have more sustainability and go after things like plastic bags in our state, et cetera. So connecting with like-minded organizations so that we grow stronger. And then on that same token, I've joined the Leadership Council for the unit to join nurses on issues that are important to them. We're working on building morale and those kinds of things. But at the end of that meeting, I have said, what do you think about having a sustainability section of this Leadership Council? And then maybe some people don't care, but a few said, I think that's great. In fact, I've been thinking about the pink buckets, the pink emesis basins, right, that we use, and all the things they put in the buckets to prepare for a new ICU admission. They said so much of it is not needed, and yet once it enters the patient room, it goes in the trash. And so then I'm able to say, that's a great idea. Let's go after that. Let's talk to the people who establish, let's talk to the technicians who are doing it, because as we get more people involved and honor their ideas, then the enthusiasm grows and we can grow stronger. And then I recently joined the Arizona Pharmacists Association, but for you, it will be potentially a medical association, just as a side membership, but yet to find out what they're doing, and then to say, how about a speaker on sustainability at the next convention, so that, again, we can reach more people, create ideas, talk about what else we can do. And then keeping it nonpartisan, I think, is really exciting, because I looked at the data of what types of faiths and what type of political parties are least likely to care about this issue, or to be the climate deniers, right? With other beliefs, and yet within those practices, there are movements. There are evangelical Christians for climate action. There are conservatives for conservation. There are things going on that really I get so inspired, because if we can reach out to them and have a nonpartisan effort too, then we can have greater effect on policy and on what's happening state and nationally, et cetera. So keeping it nonpartisan, being open to those who are not interested and why they're not interested, so that we can be thoughtful about those perspectives, and then and be open to changing the way we deliver our message, et cetera. This is just a flyer of the event we had last Saturday, in which we pulled in other associations together to clean the trash out of the Rillito. Have any of you noticed the trash in the Rillito? Yeah, when you go biking or running or jogging, there's so much trash, that big gulp cups, et cetera. So nice effort, and that is happening more regularly than I recognized. And it's a nice way to go down and get the plastic out of our waterways. Go big. I'm going to turn to Dr. Drummond now, because I want him to talk about how to approach administration for multidisciplinary support and funding, so that we can have a bigger impact on our institution. Brian, can you take that on?
Yeah, so I think Yvonne's doing an awesome job. The big things is, right, how do you it's easy to go after smaller organizations. It's easy to talk to C-suite people when you know them. It's easy to talk to, your CEO when there's a very small hospital or a clinic, or you're in charge. But how do you do this when you're, working with like a bigger organization? And so you have to find, what are they most interested in, right? They're usually interested in, one, the bottom line. So money always talks. Two, they're interested in their name and how their name is right? Which goes into marketing. How can you market this? How does your name appear? How do people think about you in the community? A lot of the surveys that you'll find, throughout your career are based on, how the doctors are, how the site is, do they like their experience? So it's all patient experience. So marketing, and then who are your competitors, right? How are you going to have a step up on someone else in the community? Why is someone going to choose you? And if this is something a patient values, they're going to come here. So the biggest thing I try to hit is like trying to find a financial edge, because money will trump everything for almost every administrator. You talk to your supply people and everything, money is always number one. Well, it's a cost thing. We don't, but if you, it's a time thing. Well, if you can show that it's worthwhile and they will save money, they somehow make the time for it. So that's kind of, trying to find this approach. So we reached out to two groups. So like Yvonne's reached out to Gordon Crar, who's our chief medical officer. And then I am working on, I put out to like our supply chain, because there's I'll put the notes here, but Practice Green Health is a consulting system that helps healthcare agencies work through and has like a go by to how to improve yourself. So it's hard for you as an individual or you as an organization to just invent the wheel. And like, how do you come up? We got to pull all this stuff together. So sometimes asking another agency and saying, can you walk us through the process? Just like many corporations ask for consultants for help for problems, Practice Green Health serves that role. They have basically a toolkit that you can run through things. So one of the issues is trying to cost out what those consulting services. So I had reached out to Project Green Health and just asked, and found out like for our South campus, it was going to be $4,000 for a year. And for our University campus and South campus, total Y would be $13,000 a year. So I'm like, well, that seems reasonable. It's not overly expensive. At the same time, a couple months later, the same person I talked to there said, hey, do you know that your supply chain for Banner has reached out to us? 2 different people. So then I finally just decided to straight call like the senior vice president, Doug Bowen, and the other Melissa Kennedy, who were on the 2 people that I got their names. And so they've actually returned emails and are like, yeah, if you can get your CEO and everything to be interested, we're happy to do that from a supply chain. So they were not totally against it. So then I was trying to get Lisa Stone came to take over. She's taken over at the South campus, the chief of staff role. So she'd be the head physician down there. So I talked to Lisa and, we could go for a joint commission sustainability certificate. This would be something we could do at South campus. And she's like, yeah, let's do it as part of my initiative as chief of staff. So trying to tailor into someone else's realm. And then we used that, and she sent a letter to Sarah Frost, who's our CEO, trying to get her feedback. And so didn't hear much, not much was going on. I knew Sarah Frost when she was the head administrator at South, and I was a medical director. So we have been in meetings together and she knows me. So that's a good thing. Like when you get on, this is a good knowledge point. As you grow in your career, you will be on committees or be involved with stuff. Medicine is not just medicine. It's learning who the administrators are, learning other, disciplinary aspects of the hospital and relating to them. And if you have positive relations with them, you can then leverage those like anything else with networking going forward. So I sent another email, and Yvonne sent an email like within 24 hours as well. And so we both hit her from 2 different aspects. And so now we're going to have a meeting with her in April, and hopefully we can get something moving forward into a sustainability realm. The thing I am going to be trying to pitch is, one, just to even start a sustainability committee that they are willing to support. Because if your C-suite is willing to support, that makes a big difference, right? I can't go get the EVS people. I can't get the, that's environmental services. I can't go get the supply chain. I can't get the pharmacy. I can't get the OR unless the boss is saying, this is something that you need to do. And then they'll show up at the table and we'll work the problem. So that's what we're trying to get right now to move that forward. And the Joint Commission Sustainability certification is a great thing that we're going to be able to do. It's new this year. You basically do a needs assessment. You look at all your greenhouse gas emissions at your institutions, which is basically your energy, your consumption, and all those are out there statement wise. You can get that. Then you chose 3 areas that you want to work and reduce. And then you show that you reduced it. And you choose your percentage. You want to go 1%, you can do 1%, and you can still aim for it. The Joint Commission is still trying, I talked to them about this, and they're still trying to figure out, like, well, someone set a 10% goal and then they got 9%. Are they a failure and they don't get recertified? And they're like, well, I think we got to figure out a way, because they really made a difference, but they didn't make it to their goal. But then otherwise people will say, like, we'll improve by 0.0001%. And you're like, well, that's not helpful. Like, we want you to show a definite, decrease. So Joint Commission is still kind of flushing it out, but it is definitely hard and daunting to go after the bigger the organization, the harder it will be. The key, I think, is trying to gather momentum and support at a leadership level. And if we can get that, we can exert downward pressure is going to be easier. And sometimes that requires relationships or going for small wins. We're not looking to change the system overnight, but can we make something small that starts something, and then we start to peck away at other issues and work those. So I'd like to change it all overnight, but I don't think that's going to happen. But we are trying to do some stuff at Banner, but Banner is definitely a dragon to slay. How does that, Yvonne? Does that kind of cover?
Thank you. That's great. That's great. Obviously, there's lots of research opportunities, but I want now to wrap it up by turning back to you. You are the next generation. And like I said when I started it, this is all such a new movement. It's in its infancy. And I won't be in the profession much longer, yet you're just entering it. So could we just wrap it up by turning back to each of you and what are some of the practices that you see in healthcare that can be changed to be more sustainable? If you have any thoughts, you don't have to answer both these questions, but one or the other, I do want to hear from you. And then any sustainable habits that you have seen in friends, family, colleagues adopt recently that kind of encourages you, with seeing change. So can we do that? Let's see, starting with, I'm going to go backwards this time. David, do you mind just from what we've talked about, do you see some practices that can be changed to be more sustainable?
I remember when I was on my burn and complex wound rotation, a lot of it is just, wrapping up wounds with Kerlix, ACE bandages. But I remember a lot of us, the interns specifically, they would just go into the supply room, grab as many as they maybe 4 or 5, 6 Kerlix rolls. And at the end of the day, they'd use maybe 2. And then because of that sign, because I think it probably says it on all supply rooms, near where the patients were, you can't return those supplies once they were taken from the supply room. So that's one area that I saw a lot of, where we would be done with the patient, and they would be ready to discharge, and then they'd have still a couple rolls in the corner, and we would just say, you could take it home. But at the end of the day, I feel like that's an area where kind of the interns might need more informing of.
Love that. Okay. How about Ilya?
So something I've seen, and I don't know how, please correct me if this doesn't fit into the realm of sustainability, but in surgery, I've seen it so many times, and I've been a participant in this too. You don your sterile gown and gloves and everything, and then for whatever reason, there I don't know, there's a number of situations. Something happens where, maybe you're told, or maybe the surgeon themselves does this, or the resident surgeons, they take it off before doing anything. Maybe something was forgotten, or maybe there's some kind of delay or something, I don't know. But people just take everything off and throw it away. And that's always stood out to me because it's happened a lot. I've seen it quite a few times. And I've wondered what, like, weird, aren't we being kind of, I've never expressed this to anyone for obvious reasons, but I've thought in my mind every time, what the hell is going on? You know, we're just throwing away completely clean, sterile gowns, right? And gloves. Usually it's like, for me, for example, I'm wearing two sterile gloves on each hand and a gown. And if I need to like remove this, I just threw away, I don't know how much money worth of material. And there was probably some carbon footprint involved in the production of that material. You know, now that we're talking about it, I guess I can relate it to that. So that's just something I wonder if that can be optimized somehow. I mean, and one idea I have, maybe, you know, we have this entire protocol. I'm not going to surgery, so I shouldn't say we, but there's an entire protocol in surgery where you obviously do the timeout, right? Maybe there's room for including some kind of sterile gown element into that to reduce the amount of waste related to that. And that's another thing too, is, you know, the sterile gowns, they are also waste at that point. So wouldn't we also have less waste if we use less sterile gowns and gloves and things of that nature? But yeah, I hope that kind of relates to all of this.
Yeah, absolutely. Let's see, Kaylin.
Although this isn't an original idea because you had it in your slides, it's something that I've witnessed. The gowns, just to go into a patient's room, in Flagstaff, they had reusable gowns, and it kind of threw me off when I was up there. But it like totally got used to it, and it seemed like way more efficient. And then after that rotation, I was in the pediatric ICU, and I would use probably 4 or 5 gowns a day just for one of my patients. And that was just me alone, like not including the resident that was also with the patient, or that was also following the patient, you know, the attending, and then the pulmonologist that was following along. Like, so many gowns go into it. So and I think in situations or in like areas of the hospital where I don't know if the likelihood that this could happen, but when you're going into one patient's room time and time again, like having not only a reusable gown, but maybe like reusable gowns with your name on it, where like you don't blow through 10 reusable gowns in one day. I don't know if like then that just increases the infection risk because now it's been in the room before, but I'm not sure. I just think the gown is like such a huge waste of plastic, and half the time, like being a student, we'll put the gowns on and like go into the room when realistically we don't need to go into the room. Like if there was any teaching to be had, like it could have been taught to us outside of the room. Like we didn't need to go in and gown up, or like 3 students didn't need to go in at one time. Like just being aware of who actually needs to gown, and if Banner could switch to the reusable gowns, because I didn't think it was a little weird at first in Flagstaff, but that's just because I didn't know we had reusable gowns. So that was the only reason it was strange to me.
Cool. Brian, I want to be respectful of time. Do we have time to hear from our other 3 students?
Yeah, Christy, are you able to stay like 5 minutes beyond your time, or do you have to head out right after your lecture?
No, I can stick around. I was going to say though that a lot of the things that are being discussed right now, I'm going to be talking about in my lecture as well. So we're going to get back to it.
Oh, good.
Perfect.
Okay, very good. April?
I think styrofoam for all the food in the cafeteria, it would cost more money, but to get it in more of a cardboard or whatever, more biodegradable containers. And then in the ED, they have those plastic big cups that I see a lot of the residents using. Are those go in the trash, right? Yeah. So that's kind of an issue as well.
What are the cups for?
Like I think they're for the patients, but the residents will use them just to drink water.
Mhm. Okay.
Yeah, they'll pour a soda and ice into the plastic cup, but not bring their own.
Okay. Thank you. Let's see, Erica.
Yeah, one thing that always bothered me was when we do have to like don PPE going into rooms was like not reusing N95s. I feel like those are things that like can be used. I don't know how cleanly that is, but like I know for me personally, like I would just keep my N95 in my pocket and just go around with it versus like I saw a lot of the team members would just like open a brand new package and then after like 2 minutes of use would just throw it out, and even though they were keeping distance and everything else in the room. So I feel like that's definitely room for improvement, and maybe that's more of like an education standpoint. But something else that my husband and I do at home is we use gray water to like water all of our plants. So was just the sustainable habit that I was going to mention.
Not bad. Thank you. Sarah.
I'll answer the second question. One thing that I've noticed some people doing now is instead of buying dryer sheets, like they'll buy these like kind of woolly cotton balls that they throw in the dryer that kind of like have the same function as the dryer sheets, but they're not like a single use thing that you just use and throw away immediately after. But one thing in general that I've been trying to do is just to like overall stop over consuming things, because I feel like I already own a lot of items in general, whether it be like clothes or shoes or just all these different things. And I feel like I don't need to keep buying things at the same rate because I don't need to own so many more things than I already own. So I'm trying to be more conscious of buying less, or like I already have like so many of this, I don't need to add more to the pile of things that I own.
Awesome. Oh my gosh, I love all your ideas. You are an inspiration. I just have to conclude, my hope is that we can get more people to see what is happening with healthcare waste, because once you see it, you can't unsee. In fact, you start to see more, just like when I went back to the ICU and after 20 years, I started thinking, why are they using IV electrolyte replacement on a patient eating a sandwich? You know, this is something I can try to go after. And perhaps it can encourage personal change for individuals and families, because we start in the healthcare setting, but then maybe, like you just mentioned, Sarah, you go home and you start thinking about your own home environment and things that can be done there. So bottom line is we can make a big difference. And I really am excited about you and your ideas, and I'm grateful for this time together. Thanks so much.